Hello, everybody. And this is Steve here with Dr. Matt. Dr. Matt, how are you doing today?
Doing well, Steve. Thanks. How about you?
Good, good. Well, today we're going to talk about one of those tougher subjects for people. They're kind of embarrassed and really they shouldn't be. But we're going to talk about low libido. And this is a hard topic for people to talk about, Dr. Matt, isn't it typically?
Yeah, yeah. I mean, I would say most people are relatively quiet about it. Some people bring it up, during an intake process, I guess, just their intake forms before they meet with me. It's something I'll always typically inquire about.
Yep.
But most individuals won't, come, with that basically as one of their chief complaints that they're, wanting to address.
Right. Do you think a lot of people just silently suffer and don't address it?
I think that's true. Yeah, I think it's pretty common, and I think it's part of a constellation of things that kind of happen with I think our culture and lifestyle and the way we live and such. And
Right.
some of it's dependent on our age and where we're at and that,
Sure.
but other health conditions as well. But
Sure. So talk about, I mean, and you might want to bifurcate between men and women a little bit. I'm not sure, but I mean, what are some of the common drivers that are underlying this issue and leading to it? And I know there's physical, there's probably mental health, and there's also relational, like between the spouses component.
yeah, I mean, it's pretty common, with men when they hit 40s, 50s on and such that sometimes as a byproduct of their hormones that are shifting, and there's basically a reduction over time. It typically starts around age 30 or so of testosterone. That can play a role. Women, when they hit menopause or even perimenopause, around that time frame before they actually transition into menopause, we'll start to notice that being one of many other typically symptoms, if they are symptomatic, of things that they go through. So that's a kind of a common, I guess, way to discuss the two of them. I will say it's not necessarily always, what the common causes are. I mean, there's a lot of different things that can cause this, especially even in younger individuals. I see, people in their 30s, sometimes younger, right, that experience that as well. And I mean, that can be from with anybody. I assess their lifestyle, check to see how their sleep is. Sleep quality plays a role. Stress
Sure.
levels play a pretty significant role, at least in my history work when people. It's typically one of the components that can impact it. Nutrition plays a role as well, and then just physical activity or inactivity, I should say, basically will play a role. Those are some big components. And then looking at, when I dig in and start testing, it's pretty unique, but things like their microbiome can play a role. So the bacteria in the gastrointestinal tract can effectively, impact things like, how they metabolize their estrogen. So some people will have just higher estrogen levels just based on their, certain microbes that they have in their gastrointestinal tract. Things like increased intestinal permeability. So, the lining of the gut doesn't filter as well, and you start to get, bigger molecules that get into the bloodstream, create inflammation. And that creates typically a cascade of effect on the hormones as well, and can, in a sense, play a role on libido. Insulin levels, so insulin resistance can affect, through like several mechanisms, but can affect libido. I mean, that can cause more weight gain, It can increase leptin levels. You get insulin resistance, leptin resistance. These things can impact.
Does that also hurt men with, ED problems? Is that part of that problem potentially with the?
Well, yeah. So insulin resistance. The erectile dysfunction. It's typically a little more complex in a sense. There's a lot of factors that can affect that, but in a sense, the insulin resistance, if you're getting higher blood sugar levels, that can actually affect the blood flow longer term, and that can impact that. It can also impact testosterone levels. So typically insulin resistance will actually drop testosterone levels, so that can play a role in that as well. And it can actually increase kind of indirectly estrogen levels, which can impact libido and even erectile function as well. So
the way you're saying is it's kind of a canary in the coal mine. It could be a leading indicator or a symptom of greater underlying medical issues, not just I don't feel like having sex. It actually could be potentially a serious medical problem.
Yeah, a lot of chronic complex conditions, diseases and such, can in a sense affect this, and that could be one of the symptoms.
Mm-hmm. What about mental health, Dr. Matt? Obviously you're a physician. Is that part of the equation potentially to have them assessed for anxiety or depression or something like that?
I didn't hear what you said on that. What was it?
Oh, sorry. What about mental health? Can that be a component of this? Can somebody's anxiety or depression or some other mental health condition apart from physiology contribute to this?
Oh, 100%. Depression's one for sure. Anxiety for sure. And then there's even, individuals that specifically get, performance anxiety, where that plays a role and, affects their drive, libido. Yeah. Even medications associated with treating anxiety and depression, things like SSRIs, their side effects can be low libido, so even other medications like statin medications, they've done studies where they've measured, testosterone levels, because that's essentially affects cholesterol, and cholesterol is the backbone to make things like testosterone, and they've shown that as a correlation with those medications for individuals.
Yeah, that's interesting. I actually lost my train of thought what I was going to ask, but I guess what we could do now. Oh, I know what it was. Is I've learned from you from talking through some of the case studies that we've put together. How gut health can be causal in anxiety. That was a surprise to me. And maybe I didn't get that right. Is that true? Like if you have serious gut health problems, it can also cause some mental health conditions?
100%.
Gotcha.
Yeah, so you've got the gut-brain axis. Just going back to the microbes, right? So there are specific strains of bacteria that, are involved in producing things like GABA, which is a neurotransmitter. That's a calming neurotransmitter.
Yep.
And, lower levels of that can be associated with higher levels of anxiety, inflammation, for example. That stems from the gastrointestinal tract, can drive anxiety and or depression. About 95% of our serotonin is made in the gastrointestinal tract. And that's another inhibitory neurotransmitter that can help put the brakes on an overexcitatory process. So
you also, like with certain clients, people have genetic weaknesses that will lead to things like serotonin and dopamine not properly secreting in the bloodstream, right?
Right. Mm-hmm. And then you even get the essentially indirect, it's or a byproduct essentially of the effects of the gastrointestinal tract. So if you got inflammation of the gastrointestinal tract, and some of those inflammatory molecules either enter or create other inflammatory molecules in the bloodstream, can actually impact the brain and cause neuroinflammation, which can present as anxiety.
Yeah.
So
That's amazing. I love nerding out with this stuff with you. But what that tells me is that especially with people that work with us, that it might be a good idea to work with you for a while, or Dr. Delia, on the physiology side first, maybe before you go the mental health route, because if you can eliminate some of these issues and see if that resolves the mental health before you go spend time and money on that. Is that like a halfway decent way to look at that? Like maybe attack the physiology first?
Yeah, I think it's why not address potential root causes?
Yep.
First, if they are involved, address those. And that way you're not chasing some other things that maybe aren't really addressing the cause of it. So
right. So if somebody's watching this and they're sitting here and they're 45, 55, maybe even 60, and they are frustrated with their libido. It's not a relational issue between their spouse. They feel like pretty normal otherwise mentally. They just don't know why. How maybe give a simple overview of how you as a clinician would approach their case.
Well, first I check to see how they're sleeping. Are they getting a minimum of 7, total hours of quality sleep a night?
Yep.
Are they, practicing some sort of a stress management practice to build resilience in the typically, stressful world that we live in? I'd look at their nutrition levels. I mean, things like low iron, vitamin D, zinc, things like that are even associated with low libido. So how are they, where are they at with their, with those levels? And, just looking at eating a nutrient rich, basically a dense diet in that sense, low in inflammatory foods and low in processed, refined carbs and such. And, other than that, I mean, are they exercising? They getting some good physical activity, because that impacts all those typically hormones in the positive way that you want them to go. And then I would do a deeper dive, on tests, and such, to see really where they're at with their, physiology. Some of it maybe like you mentioned, could be some stuff affiliated with, maybe genetics, but we'll be looking at gut health, the microbiome, rest of their blood markers, lots of different hormone markers that can impact this.
Pull a mosaic of data together and connect the dots, right?
Yeah, and prioritize them. Mm-hmm.
Yep. Yeah. Okay. Well, this is excellent. I think personally, listening to this video, people would get a very good baseline understanding of how you could help them if they work with us, or if nothing else, they got educated in what to ask their own doctor in their home. So thank you, Dr. Matt. I appreciate the time today.
No worries. You got it, Steve.